Hello, my name is Jeanette Morn. I'm a Macmillan Urology Nurse Specialist at South Tyneside and Sunderland City Hospitals, and I'm involved in the care of patients having treatment for urology cancers, to include bladder cancer as well as prostate cancer. Some treatments for cancer, like surgery, radiotherapy and hormonal therapy, can cause changes that can make it physically difficult for men to achieve or maintain an erection suitable for penetration. We call this problem erectile dysfunction. The nerves and blood vessels that help to create the erection can be damaged as a result of cancer treatment, and for men on hormonal therapy, this can lead to a loss of desire, which is also an issue. For some men, these problems can also happen for other reasons, as a number of other medical conditions unrelated to cancer can commonly cause erectile difficulties in men. It's important that you don't feel embarrassed to ask for help and advice about this. Your consultant, your nurse specialist and your GP will deal with these issues all the time. They will be happy to give you advice about treatment that will help to restore your erections, or they can refer you to a separate team who can help with this problem. Sometimes a cancer diagnosis and the effects of cancer treatment can create emotional changes as well as physical changes within the body. Some men report that they feel that something important is missing. This can alter desire as well as change the way that they feel about their body. This can then lead to stress and anxiety, and it can also have an effect on relationships with partners. There are a number of ways to get support and advice to help with this. Your doctor or nurse specialist can advise and signpost you for the relevant help and support you need, such as online support, local support groups, or sometimes advice regarding medication. Some men may find it useful to have counselling, either in a one-to-one setting or as a couple. You can be referred for specialist counselling if this is felt to be the right treatment for you. It's also important for you to know that it's very safe to have treatment for erectile dysfunction after cancer treatment. It will not increase the risk of your cancer coming back or affect how well your treatment works. Cancer cannot be passed on through sex, so there is no risk to your partner. There are also other things that you can do to help. Keeping physically active, maintaining a healthy weight, and stopping smoking can all help to make a difference. For some men, erectile dysfunction can be temporary and erections may recover after a period of time. For men whose erectile difficulties persist, there are a variety of different treatment options which I'll discuss now. Most men will need to try more than one treatment before they find something that works well for them. It's important not to feel discouraged. You need to realise that in order to find the treatment that works the best, it may take some time and you will need to persevere. Physical treatments that can help restore erections are available in the form of tablets, pellets, creams, injections, vacuum devices or surgery. As far as tablet treatments are concerned, a group of tablets called PDE5 inhibitors can be used to help men achieve and maintain their erections. These tablets include Viagra and Cialis, although other tablets are also available which can provide the same response. These drugs are designed to improve and encourage blood flow to the penis during the arousal process. This improves the quality of the erection. The tablets need to be taken about 30 to 60 minutes before sexual activity. It's common for the tablets not to work well the first few times you use them, and it's recommended that you should use them on a number of occasions before you can really know if they are a good treatment for you. Your doctor or nurse specialist can advise whether this is a suitable treatment for you, as some medications cannot be taken with PDE5 inhibitors and may be contraindicated. This will need to be checked before treatment can be started. Erection problems can also be treated with an injection that you were taught to self-administer. This may sound complicated, but these injections are very simple to use and should not be painful. You may need to be referred to an erectile dysfunction clinic where the doctor or nurse will show you how to give the injection so that you are confident to use it safely at home. The drug is injected into the side of the penis using a small needle, and it usually works within about 10 minutes. You will be given advice about the correct dose to use, as well as advice about any side effects the drug may have. Injection treatment can give a very good response in some men. Because of this, the dose of treatment needs to be carefully managed, as there can be a potential risk of a prolonged erection if the dose is too high. As a result, it is usually recommended that this treatment is started at a low dose and the dose is then slowly increased to avoid the risk of a prolonged erection. This means that it may take a few attempts before you find the dose of the drug which works best for you. It can also take some time for you to feel fully confident and relaxed in using this treatment. But most men who use injection treatment find that it will provide a good response. There is also the option of using a pellet or cream treatment instead. The pellet treatment is called Muse and involves using a small applicator to insert a wax pellet about the size of a grain of rice into the opening at the tip of the penis. After insertion, the drug is then absorbed through the lining of the flow pipe, and it encourages blood flow into the penis. This process takes about 20 minutes before you can notice any response. One of the common side effects of this treatment is mild discomfort in the penis following its use. This is usually short-lived. An alternative to this treatment is a topical cream called Vitaros. This drug works in a similar way, but the drug is contained in a cream that is squirted onto the tip of the penis rather than inserted. These treatments do not usually work as powerfully as the injection treatment, but they can still be a good option for many men. An alternative treatment option that doesn't involve using medication is vacuum pump therapy. This treatment involves using a vacuum device, which is a piece of medical equipment that is classed as a medical device. It's available on prescription, but it can also be purchased from the supplier without a prescription. It consists of a clear plastic cylinder which has a pump attached to it. The penis is placed inside the cylinder and the pump is then used to remove the air within it. This creates a vacuum which encourages blood flow into the penis. A stretchy constriction band is then placed around the base of the penis to help maintain the erection. Vacuum pump therapy can be used as many times as you want, but the band should not be kept in place for longer than 30 minutes at a time. Sometimes the pump can be used without the constriction bands as a therapeutic treatment to help keep penile tissue healthy following cancer treatment. It can help to maintain penile size and also help with the potential recovery of any natural erections. Men who take blood thinning tablets may not be able to use this treatment because of the risk of bruising or bleeding that may occur. For some men who do not respond to any of the treatments previously discussed, there is an option for surgery to insert penile implants. Two types of implants are available, either semi-rigid rod implants or inflatable rods. Both of these operations are performed under a general anaesthetic, which means you will be asleep. The semi-rigid rod implant means that the penis will be firm all of the time, but the penis is bent down when an erection is not needed. After surgery, when you want an erection, you squeeze the small pump in the scrotum, which will fill the rods in the penis with water to create an erection. Not all men will be suitable for this type of operation, but you can have a discussion with your doctor and nurse specialist about it if you'd like more information. For some men, erectile difficulties can persist even despite treatment. Some men may not respond to treatment, some men may not be suitable for treatment, or some men may decide that they do not wish to pursue treatment. This is an entirely personal decision for each man to make, but having information about the various treatment options available will at least allow you to make an informed decision about whether you wish to pursue treatment or not. If you have any concerns, please contact your nurse specialist or GP.